Now try to define or try to look at what is known as cellulitis. So what is cellulitis? Of course, in pathology, anytime you see any word and you see itis added to it, it simply means that there's inflammation of that tissue, you know. So cellulitis is inflammation of the cells of the skin, you understand, and subcutaneous tissue. So it's usually from a bacterial infection, and the two common bacteria that usually cause inflammation of the skin or inflammation of the subcutaneous tissues are the what? Streptococcus pyogenes and also Staphylococcus aureus. So you have a lot of redness there, you have a lot of warmth. Of course, if you put your hand on this place, it should be warm. You understand? And there's pain. All right. The person will not be able to use that link like they used before. Causes Streptococcus pyogenes, Staphylococcus aureus, the two guys that are usually a culprit of this. So they usually infect you from cuts, could be abrasions, could be insect bites, could be ulcers, could be surgical wounds. Do you understand? And they will infect you faster if you have diabetes, if you have venous insufficiency. So a part of the body that the blood supply is not really adequate again. Lymphedema and also immunosuppression. So clinical features is what? There's redness, okay, swelling and warmth, tenderness or pain, skin will feel tight, it's swollen, so the skin is tight and gloss is shining. Alright, systemic signs is the infection could also track into the blood, that's bacteremia, get to other parts of the body, causing you fever, chills, and malaise. Also lymphadenopathy, so inflammations or swellings of the lymph nodes. Alright, so you diagnose this from blood tests where you get to see that white blood cells, their levels are going up, C-reactive proteins, the levels is going up. If you do imaging, you know, you can also see the extent of the infection. If you do culture, you now be able to pinpoint the microorganism that's actually causing that issue. Treatment is antibiotics, so the oral ones, that's if the issue is mild, amoxicillin, cefalexin, clindamycin. For intravenous one, that's usually when the issue is severe. So you have to put everything inside the blood. Do you understand? Ceftriaxone, vancomycin. So it's also supportive care like the person should rest, elevation of affected limb, analgesics, surgical drainage if there's abscess or necrotic tissue is present.